welcome back to my channel. Okay, so obviously you will see that from my last video, things have changed. Or not really changed. I'm still dressed the same. I still look a hot mess. And there you go. So you will know that all this is filmed on the same day, just for future reference. Okay, so today's video is going to be emergency medical technician, or EMT, and ambulance technician are terms used in some countries to denote a healthcare provider of emergency medical services. Now, I've stated so many times in videos that my father figure was an EMT. She enjoyed it. She loved it. Granted, it got to her at times, but you know, anything that involves saving people or not saving people will get to people. Okay, so EMTs are clinicians trained to respond quickly to emergency situations regarding medical issues, traumatic injuries, and accident scenes under the British system and those that are influenced by it. They are referred to as ambulance technicians, often shorthanded to techs. While in the American system and its influenced countries, they are referred to as American, I don't know what I'm doing, emergency medical technicians. EMTs are most commonly found working in ambulances, but should not be confused with ambulance drivers or ambulance attendants. Ambulance staff who in the past were not trained in emergency care or driving. EMTs are often employed by private ambulance services, governments, and hospitals, but are also often employed by fire departments and seen on fire apparatus, in police departments and seen on police vehicles, and there are many firefighter EMTs and police officer EMTs. EMTs operate under a limited scope of practice. EMTs are normally supervised by a medical director who is a physician. Some EMTs are paid employees, while others, particularly those in rural areas, are volunteers. Again, obviously they're not paid. That's what volunteers mean. They volunteer their time to help people. They're not paid. They probably didn't ask for it. Alright, so, moving on. In Canada, the variation of the Canadian paramedic practice, although a national census by way of the National Occupational Competency Profile identifies certain knowledge, skills, and abilities as being most synonymous with a given level of paramedic practice. Each province retains ultimate authority in legislating the actual administration and delivery of emergency medical services within its own borders. For this reason, any discussion of paramedic practice in Canada is necessarily broad and general. Specific regulatory frameworks and questions related to paramedic practice can only definitely be answered by consulting relevant provincial legislation, although provincial paramedic associations may often offer a simpler overview of this topic when it is restricted to a province-by-province basis. Yeah, so in other words, Canada is complicating. In Canada, the levels of paramedic practice as defined by the national, so on and so forth, are emergency medical responder, EMR, primary care paramedic, advanced care paramedic, and critical care paramedic. Okay, I don't want to read all about Canada because not in Canada, so yeah. Training in Canada. Paramedic training in Canada varies regionally. For example, the training may be 8 months, British Columbia, or 2 to 4 years in Ontario, Alberta in length. The nature of training and how it is regulated, like actual paramedic practice, varies from province to province. Okay, in Ireland, emergency medical technician is a legally defined title in the Republic of Ireland based on the standards set by the Pre-Hospital Emergency Care Council, or PHECC. Emergency medical technician is the entry-level standard for practitioner for employment within the ambulance service. Currently, EMTs are authorized to work on non-emergency ambulances only as the standard for emergency. Causes a minimum of a 2 paramedic crew. EMTs are a vital part of of voluntary auxiliary services where a practitioner must be on board any ambulance in the process of transporting a patient to the hospital. The responder levels are as follows. The abbreviations, and I'm just going to read these out, and I'm not going to go ahead and read all these out because it looks pretty short. Cardiac first responder, which is CFR, trained in BLS with emphasis on CPR and the automated external defibrillator. Occupational first aider, OFA, trained as CFR with additional training in management of bleeding, fractures, etc., particularly in the workforce. Emergency first responder, EFR, extensive first aid and BLS training with introduction to oxygen therapy and assisting practitioners with care. The practitioner levels are as followed. Emergency medical technician, which is EMT, entry-level EMS, healthcare professional, trained in BLS, anatomy, physiology, pathology, pathopsychology, pharmacology, ECG monitoring, advanced airway management, and spinal immobilization. The next one, paramedic, which is just P for the abbreviation. Emergency ambulance practitioner, trained in advanced pharmacology, advanced airway management, etc. Advanced paramedic, which is AP, trained to paramedic level plus IV and IO, access a wide range of medications, tracheal intubation, manual defib, etc. So that's all in Ireland. The United Kingdom, let's see, I don't want to repeat the same thing over and over again, so okay, emergency medical technician is a term that has existed for many years in the United Kingdom. Since National Health Service ambulance services are running EMT conversion courses for staff who are trained by the Institute of Healthcare Development, or IHCD, as ambulance technicians and assistant ambulance practitioners. Ambulance trusts such as the London Ambulance Service and the Northwest Ambulance Service are in the process of converting existing ambulance technicians into emergency medical technician grades 1, 2, 3, or 4 based on their level of experience, in many cases providing a similar level of care to that of a paramedic. Emergency medical technicians are still widely deployed in private ambulance companies with IHCD NHS trained emergency technicians being particularly sought after. There are also many newer EMT training courses available. IHCD ambulance technicians and assistant ambulance practitioners still exist within other UK ambulance services, with emergency care assistants employed in some areas as support. However, this grade of staff is now being phased out and replaced with a much lower qualified emergency care assistants. I don't know what any of that means. Anyway, the exception to this is the East of England Ambulance Service, who have selectively stopped training emergency care assistants and is upskill training them to emergency medical technician level with the intention of being converted to EMT from EMTs to paramedics, thus upskilling the entire workforce. Example of skills that may be had by an emergency medical technician in the UK are as follows: administration of selected drugs, usually not IV medications, people. Intermediate life support, including manual defibrillation and supraglottic airways adjuncts. I don't know what that means, so I'll have to look that up. Ability to discharge patient to different care pathways. And last but not least, IV cannulation, usually hospital EMT skill. In this country, which looks like there's freaking a lot, so we're just going to skip ahead some after I read a little bit. The concept of modern day emergency medical services, EMS, care is widely noted to begin with the academic paper, Accidental Death and Disability, the Neglected Disease of Modern Society, or White Paper. In 1966, according to EMS textbooks and relevant academia in the field, this paper detailed the statistics of highway accidents resulting in injury and death in the mid-1960s, as well as other causes of injury and death, and used this statistics to confirm that reform was needed in the U.S. Moving on. Especially concerning public education and the amount of CPR and BLS and first aid training received by police officers, firefighters, and ambulance services at that time. The EMT program in the United States began as part of the Alexandria Plan in the early 1970s, in addition to a growing issue with injuries associated with car accidents. Emergency medicine EM has a medical specialty is relatively young. Prior to the 1960s and 1970s, hospital emergency departments were generally staffed by physicians on staff at the hospital on a rotating basis, among them general surgeons, internists, psychiatrists, and dermatologists. Physicians in training, interns and residents, foreign medical graduates, and sometimes nurses are also staffed the emergency department, also known as ED. EM was born as a specialty in order to fill the time commitment required by physicians on staff to work in increasingly chaotic emergency departments of the time. Okay, so the first of such groups was headed by Dr. James DeWitt Mills, who, along with 4 associate physicians, Dr. Clamers A. Logridge, Dr. William Weaver, Dr. John McDade, and Dr. Stephen Bednar at Alexandria Hospital, VA. That's the state. Established 24/7 year-round emergency care, which became known as the Alexandria Plan. It was not until the establishment of American College of Emergency Physicians, ACEP, and the recognition of emergency medicine training programs by the AMA and the AOA, and in 1979, a historical vote by the American Board of Medical Specialties that EM became a recognized medical specialty. So there you go. That's how that all started. Certification. In the U.S., EMTs are certified according to their level of training. Individual states set their own standards of certification. In some cases, and all EMT training must meet the minimum requirements as set by the National Highway Traffic Safety Administration's NHTSA standards for curriculum. The National Registry of Emergency Medical Technicians, NREMT, as a private organization which offers certification exams based on NHTSA education guidelines and has been around since the 1970s. Currently, NREMT exams are used by 46 states as the sole basis for certification at one or more EMT certification levels. The exam consists of skills and patient assessments as well as a written portion. In order to apply for the certification, applicants must be 18 years of age or older. A few states allow 16 and 17-year-olds. Applicants must also successfully complete a state-approved EMT course that meets or exceeds the NREMT standards within the past 2 years. Those applying for the NREMT certification must also complete a state-approved EMT psychomotor exam. Okay, the levels are as follows. The NHTSA recognizes 4 levels of emergency medical technician. The first one is EMR, Emergency Medical Responder. The second one is EMT, Emergency Medical Technician. AEMT, Advanced Emergency Medical Technician. And the last one is paramedic. Some states also recognize the advanced practice paramedic or critical care paramedic level as a state-specific licensure above that of the paramedic. These critical care paramedics generally perform high-acuity transports that require skill outside the scope of a standard paramedic. In addition, EMTs can seek out specifically certifications such as Wilderness EMT, Wilderness Paramedic, Tactical EMT, and Flight Paramedic. Transition to new levels. 2009, it was posted information about a transition to a new system of levels for emergency care providers developed by NHTSA with the National EMS Scope of Practice Project. By 2014, these new levels will replace the fragmented system found around the United States. The new classification will include emergency medical responder, replacing first responder, emergency medical technician, replacing EMT basic, advanced emergency medical technician, which will replace EMT intermediate/85, and paramedic, replacing EMT intermediate 99 and EMT paramedic. Education requirements in transitioning to the new levels are substantially similar. Freaking A. Okay, so the EMR, as I read above, for anyone who doesn't know what that means, backtrack. Okay, so many of whom are volunteers, provide basic, immediate life-saving care, including bleeding control, manual stabilization of extremity fractures and suspected cervical spine injuries, eye irrigation, taking vital signs, supplemental oxygen administration, oral suctioning, positive pressure ventilation with a bag valve mask, cardiopulmonary resuscitation, also known as CPR, automated external defibrillator, also known as AED, assisting in a normal childbirth, and administration of certain basic medications such as epinephrine, auto-injectors, and oral glucose. An EMT are now trained in and allowed to administer intranasal naloxone. Yeah, I may be saying that right. An EMR can assume care for a patient while more advanced resources are on the way, and then can assist EMTs and paramedics when they arrive. EMT is the next level. They are allowed to do as follows. Skills as well as nepharyngeal airway, I butchered that, pulse oximetry, glucometry, splinting, use of a cervical collar, traction splinting, complicated childbirth delivery, and medication administration, such as epinephrine, auto-injectors, oral glucose gel, aspirin, ASA, nitroglycerin, and albuterol. Some areas may add to the scope of practice for EMTs, including naloxone administration, use of mechanical CPR devices, administration of intramuscular epinephrine and glucagon, insertion of additional airway devices and CPAP, Training requirements and treating protocols vary from area to area. Advanced EMT is the levels of training between EMT and paramedic. They can provide limited advanced life support, also known as ALS, care, including obtaining intravenous and intravascular access, use of advanced airway devices, limited medication administration, and basic cardiac monitoring. Paramedics. Paramedics represent the highest level of EMT and, in general, the highest level of pre-hospital medical provider, though some areas utilize physicians as providers on air ambulances or as a ground provider. Paramedics perform a variety of medical procedures such as industrial intubation, fluid resuscitation, drug administration, obtaining intravenous access, cardiac monitoring, continuous and 12 lead, cardioversion, transvenous pacing, cricothyrotomy, yeah, I'm obviously butchering that, manual defibrillation, chest needle decompression, and other advanced procedures and assessments. An ambulance with only EMTs is considered a basic life support, also known as BLS unit. An ambulance utilizing AEMTs is dubbed an intermediate life support, ILS, or limited advanced life support, LALS unit, and an ambulance with paramedics is dubbed an advanced life support, ALS unit. Some states allow ambulance crews to contain a mix of crew levels, an EMT and a paramedic, or an AEMT and a paramedic, to staff ambulances and operate at the level of highest trained provider. There's nothing stopping supplemental crew members to be of a certain certification. An emergency vehicle with only EMRs or a combination of both EMRs and EMTs is still dubbed basic life support unit. An EMR must be overseen by an EMT or hired to work on an ambulance. Alrighty, let's go down a bit. Really? I didn't want that. Go back. Alrighty. In some states of the U.S., many EMS agencies are run by independent, nonprofit, volunteer, first aid squads that are their own corporations set up as separate entities from fire departments. In this environment, volunteers are hired to fill certain blocks of time to cover emergency calls. These volunteers have the same state certification as their paid counterparts. In still other locations, emergency medical services are provided by volunteer agencies. College and university campuses may provide emergency medical responses on their own campus using students. In other locations, such as Boston, Massachusetts, emergency medical services are provided by a separate or third-party municipal government emergency agency. And EMTs and paramedics are employed in various settings, mainly the pre-hospital environment, such as in EMS, fire, and police agencies. They can also be found in positions ranging from hospital and healthcare settings to industrial and entertainment positions. The pre-hospital environment is loosely divided into non-emergency, which is patient transport, example, and emergency, 911 calls, services, but many ambulance services and EMS agencies operate both non-emergency and emergency care. In many places across the U.S., it is not uncommon for the primary employer of EMRs, EMTs, and paramedics to be the fire department, with the fire department providing the primary emergency medical system response, including first responder, fire apparatus, as well as ambulances. Alright, so there you go. That is the end of this video, and I will upload pictures with this as well, and hopefully you guys enjoyed, even though it's 24 minutes long, and well, 25 now. And I hope you guys enjoyed, and I will see you guys next time. Blessed be.